Hello. I am very excited about this moment because I've been waiting about 10 years for this implant to get into my hands. This is the Motiva implant. This is a game changer in breast augmentation in the United States. There have been millions of this implant procedure performed around the world, but only 3 weeks ago did the FDA approve this implant. Some of you know I'm a plastic surgeon also in Israel, and I've been using this implant. And I'm going to explain to you why today in the United States or anywhere else that has this implant, in my opinion, there are only two good choices for breast augmentation in terms of implants. There's this, and there's a saline-filled implant called the Serene, okay? So there are issues with silicone gel implants. There's an issue called silent rupture. The silent rupture rate of the three companies used in America is 10 to over 20%. That means if you scan someone 10 years after augmentation, you're going to find that 10 to over 20% of them have a hole in their implant and the implant should be replaced. But there's a bigger problem than that. You just want to get implants, you want to have soft, beautiful breasts. Well, you've heard of capsular contracture, right? That's the biggest complication from this operation. But what they won't tell you probably when you go for consults is that the incidence of that complication is about 12%, at least. And if you have it on one side, not the other, it means one side is beautiful, natural, just the way a breast should be, and the other side's kind of high and round. Now, you probably don't want any breasts that are high and round because it's fake looking, although some women want that. But you certainly don't want to have a natural breast and a high and round breast that feels hard. The incidence of capsular contracture and rupture with this implant is in the low single-digit percent, maybe 1%, according to published studies. Now, it's all about this great benefit in terms of capsular contracture and rupture has a lot to do with the surface. Now, let's talk a little bit about what's amazing about the texturing of this implant. This is a smooth silk, this is what we call it, but you need to hear a little bit of science. A micron is a tiny unit of measure. What is it, a hundredth of a millimeter, I think? It's very tiny. A red blood cell is, I think, 7 microns, right? You need a microscope to see. A smooth implant is anywhere from 1 to 4 microns of variability in how, that carpet, the high and the low of the surface. This is a 4 micron surface. It used to be called nanotextured. It looks sort of satiny, not shiny. It just turns out, and I learned this 15 years ago, which is what made me excited and waiting for this implant, that this turns out to be the surface that causes the least amount of scar tissue. It is the most biocompatible surface created by mankind. And it turns out that the texturing of the implant, meaning, and what I learned 15 years ago is when you just take the different surfaces and put them in cell culture in a lab with fibroblasts, those are the cells that make collagen, the smooth ones and the big textured one, they're called macrotextured, they cause the most fibroblasts to form, especially the macrotexture. Fibroblasts are growing like crazy. On this, they don't want to grow. Now in the body, it's the same kind of thing. The capsule, your body always knows when something artificial, man-made's inside of it. So it's going to form a capsule. But the capsule that this forms is generally like a tissue paper. It's not thick, it's not hard, it doesn't squeeze it. Whereas the other surface really encourages those fibroblasts to grow and gives you a capsule. This gel comes in 2 forms, but in either form, this gel is special in that it has amazing elasticity and viscosity, and it is a monoblock, meaning you can't peel the shell off the gel. In fact, there's a blue layer. You see this is sort of bluish? And that helps you know that the shell is completely intact, and that's very good. Nobody else has that. But when it comes to the gel, there are 2 types. Look at these 2 implants. You see how in this one, the stuff's more settling to the bottom? So it's a round implant, but it becomes a teardrop shape in the body. That's really good. This is called the Ergonomix. Very, very popular. Very cool implant, because generally a beautiful breast has a little more space between the nipple and the fold. By the volume going down more, it helps that happen, and that's really, really good. Some women, however, want to have a little more upper pole fullness. they want that look of sort of something up top. Then they can get the smooth implant that's not that's not the ergonomics. They're both considered smooth shells. They both have the exact same kind of shell, but the ergonomics, the one that settles to the bottom, is more elastic. This is a little more viscous. They both feel really, really good. Lastly, you have an option of keeping your data in the implant with an inserted chip. And again, I know to some of you that's scary, you don't want that, that's fine. But you know how many patients I have that come in 10 years, 12 years after an operation, and I don't know, one's ruptured, or they want to go just a little bigger or just a little smaller. Well, if I don't know what's inside of you, how can I go just a little bigger? I like to have the information. And if you're not going to take a photo just like you do of your passport and other important things, if you want to just be mindless and know that it's on your body, then get the chip. It'll have the date that you were implanted and all the information from the serial number of the chip that can just be read. It's same shell, same thing, it's just implanted inside, by the manufacturer. So that's another great option that nobody else offers you. So I'm very excited to be seeing you. I offer you the expertise of experience with this implant, and we're ready to do this. And the last point is that we also have great experience putting this implant, or the saline filled one, through the underarm, so you don't have to have any scar on your breasts.